For more on this, let's bring in Kate Tulenko of Corvus Health. Kate, first, great having you. Second, how do America's domestic health policies influence global health systems and outcomes?
They definitely influence them in a number of different ways. Many countries look to the U.S. to set the standards, and they look to U.S. leadership, particularly because many small or lower income countries do not have the staff. They can't afford to have the staff to do their own policy work themselves. So any change in U.S. policy will have a significant ripple effect throughout the world.
At the same time, Kate, medical associations from Florida have already warned that, for example, amusement parks and other spaces that attract kids are now potentially dangerous, hazardous for children. What can be done if you're not, if you want your kid vaccinated, you want to protect your kid, but at the same time you want to enjoy those attractions?
Yeah, so what we're seeing with this administration is for the CDC and FDA, they're moving from a regulatory position to more an advisory position, and they want the states to take more of a lead in public health. And we've actually seen that there's a coalition of Western coastal states that are now setting their own vaccine policy. And we've seen Florida, as a more conservative state, has now eliminated requirements for children in schools to get vaccines. And so we're going to see a lot more disease outbreaks, particularly for measles, rubella, and other vaccine preventable diseases. And as far as answering your question, how can individual families protect themselves, get your own children vaccinated? Most insurances are still covering the standard childhood vaccinations. The only vaccine that's in question now is the COVID vaccine. So people still have access. And we've already seen a decline in tourism to the U.S. because people are staying away for fear of being stopped at the border. And I would see an increased decline in tourism because people don't want to go to, Walt Disney World and get measles or get polio while they're there. So it can have a significant impact on the U.S. economy. In fact, the U.S. exports close to $100 billion worth of pharmaceuticals and vaccines every year. It's a huge business, and that's just the external. And so if people lose faith in the quality of our pharmaceuticals and our vaccines due to a weakened FDA, it could have quite an economic impact.
Kate, I want to go a little deeper on this. What impact do U.S. funding decisions like removing, stopping research and so on, have on health workforce development in low and middle income countries?
Well, the U.S. was one of the major funders of education of health workers, retention of health workers, upgrade training of health workers, support during crises such as this Ebola outbreak. And so with the withdrawal and reduction of funds, we can see it having potentially a huge impact. I expect response times to decrease. And we know that every disease in the world, every infectious disease in the world is just a plane ride away from the U.S. So it is quite concerning. And we are seeing regional institutions, such as PAHO for the Americas and Africa CDC for Africa and CERO for Asia. We are seeing them step up and being more active, but it's going to take a lot of reform. Hopefully in this day and age, they can use AI to become more efficient. But I think we can see a lot of transition effects, and I think we can see increase in disease spreading in the next year or two until they sort of have gotten their reforms solidified.
Yes, I'd like to go a little deeper on what you just said, because I'd like to better understand how can health organizations around the world, and they could be, local ministries in different countries, adapt when U.S. policies shift in ways that affect international aid, support, and knowledge?
Well, there'll have to be a number of different reactions. One is the reform of the way they work. The second is the funding. In fact, there are several regions that are currently considering a tax on airfares in order to fund global health. We might see some increased reforms, hopefully improving governance, reducing corruption. We do know that is a factor in a number of different countries. And frankly, we will see more outbreaks. There's no doubt about that.
Kate Tulenko, thank you so much for your time and insights.